Hi, I'm Red Alensod. I'm a urogynecologist here in Laguna Beach, California. We specialize in pelvic reconstructive surgery and aesthetic vulvovaginal surgery, and more so now in non-invasive, non-surgical vulvovaginal and feminine rejuvenation. We're going to go over some question and answers and frequently asked questions so that you can go over and learn both as a patient and as a doctor what can be done with ThermiVa. ThermiVa can be performed about 6 weeks after a vaginal birth or a cesarean section. It can be performed when the patient is breastfeeding or not breastfeeding at all. Radiofrequency energy can be used in those who are breastfeeding. It's very safe. It doesn't hurt the baby. It doesn't hurt the production of milk and can be done during breastfeeding. After vaginal birth, you can have ThermiVa procedure about 6 weeks after. This is when you can help soften up tissues, tighten up tissues, help with incontinence, and this is the time that it's quite safe to do. Patients who complain of painful intercourse, if it's caused by dryness or atrophy, can be treated successfully with ThermiVa. Those who have muscle spasms that cause painful intercourse can sometimes be helped with ThermiVa if you treat these spastic muscles. Those who are complaining of painful intercourse because of scars and bands may not be helped so much with ThermiVa, although ThermiVa can be used to soften these scarred areas. Those with undiagnosed pelvic pain should be seen and treated by their doctor first and not have a ThermiVa treatment until a diagnosis has been made. ThermiVa can be used for pretty much any age range, but our studies were done on patients that were 21 to 65. Now, I've treated many patients who are in their 80s and some in their 90s, and it still helps those with dryness in their vagina. I've also treated patients who are under 21 years old who had certain conditions such as very dry and painful vulva, lichen sclerosis when the skin's very thin, and those are situations where ThermiVa can help. Patients with IUDs can have ThermiVa treatments. The IUD sits deep in the uterus and it's out of the way. The treatment is actually in the vaginal canal and not in the uterus itself. So it's very safe to treat someone with an IUD made out of plastic or an IUD that has copper. The diagnosis of a prolapsed uterus should be done by a trained gynecologist or primary care doctor who has experience in it. What they typically do is use half a speculum and place it inside the vagina to check for the bladder and then turn it upside down and check for the rectum. During this time, the patient will bear down and push, and the doctor can then tell whether there is a prolapse or not. Patients should have a recent pap smear within 2 years before treatment. That way you can find out that the patient doesn't have any suspicious HPV virus or precancerous change. Patients with abnormal pap smears can be treated if the abnormality is low risk or low risk HPV or human papilloma virus. Those with high risk viruses should be evaluated by their gynecologist and be cleared first, and then you can consider treating them. I usually require a patient to have a pap smear within the past 2 years or so. Lichen sclerosis can be treated with radiofrequency ThermiVa. In fact, when you combine ThermiVa with platelet-rich plasma or hyaluronic acid, you can resolve a lot of these conditions. ThermiVa can be used for those who suffer from vaginal laxity. And what's vaginal laxity? That's when the vagina becomes loose and saggy and not comfortable enough to have intercourse that can be felt by the patient or enjoyed by the patient. This can happen because of childbirth, from menopause, chronic constipation, Any of these conditions that put chronic pressure and dilate the vaginal canal can cause vaginal laxity. Mostly, though, it's through childbirth. The candidates for ThermiVa are those who complain of vaginal laxity, that means looseness inside the vagina where they can't feel their partner very well. Those who have looseness in their labia majora or sagging of the majora where it doesn't look very appealing to the patient, or the patient has the sensation of feeling like they have camel toes or a bulge of their labia majora, can benefit from ThermiVa treatments. Those with incontinence, that's leaky bladder, such as those who cough, sneeze, and jump and then find themselves wet, can benefit from ThermiVa. Those with overactive bladder, those who wake up at night and have to pee all the time, or are toilet mapping and looking for toilets all over the place so that they can pee, can benefit from ThermiVa. Also, those who have dryness and feel that it's painful to have intercourse, it's just parched dry inside, can benefit from ThermiVa. And lastly, those who have orgasmic dysfunction, and these are patients who say it takes forever for them to achieve an orgasm, can be helped with ThermiVa. Those who are anorgasmic sometimes can be helped with ThermiVa. There is a wide variety of symptoms that can be helped with ThermiVa, and you should ask your doctor about them. Patients on hormone replacement therapy can continue taking their hormones because it has many benefits to it, and ThermiVa does not affect hormone replacement therapy. ThermiVa can help hormone replacement therapy by improving the skin of the labia and the vulva and adding moisture inside. There are many women with vaginal dryness who are having a hard time achieving comfortable sex and a hard time achieving orgasms. ThermiVa can help these women improve their skin health, their feminine health, so that there is good moisture and good blood flow in the clitoral area and inside the vagina so that sensitivity can be restored. ThermiVa may be able to help some of these women in achieving orgasms. ThermiVa works with stress incontinence two ways. One way is the immediate heat pulls together tissues that have been spread out into tighter approximation with each other. These same stretched out tissues were the ones that were supporting the urethra. If this is the urethra and this is the bladder, you don't leak because when you cough, you do this. And this gets kinked downwards. Well, when you have babies, when things get stretched out, the tissues beneath it get lax and loose. So now you cough and sneeze, and it does this. And there is nothing that holds it up. When you treat with ThermiVa, the stretched out loose tissues get tighter and support it. So now that when you sneeze and cough, it doesn't move. It does this. It kinks the urethra and it presses down on the urethra so you don't leak urine. Also, I think that radiofrequency helps heal muscle tissues so that the tissues and muscles around the urethra become healed and it becomes more functional. The muscles are able to contract in a unified manner to stop the leakage of urine. So two ways. One, by tightening the tissue. Two, by healing muscles so that the urethra can constrict and prevent leakage. Sometimes you may have a little bit of spotting, and the reason for that is with a ThermiVa probe, when you're doing a treatment, if the doctor pushes too high or too hard, it may touch the cervix, and the cervix bleeds easy to touch. So what most doctors do will find out where the cervix is and then do the treatments just short of it to avoid it. That way you don't get any bleeding during treatment. After ThermiVa treatments, there is really no change in your menstrual cycle. Sometimes if it does happen to give you an irregularity, usually it's from something else, such as a stressful situation, a home situation, or missing a pill. Nerves respond very well to radio frequency, and the way it happens is the blood flow increases when radio frequency is pointed on the nerves. The nerves themselves may calm down because of less irritation, because of normalized blood flow. Also, radio frequency can affect the nerves to release these vasoactive neuropeptides that dilate the blood vessels so that there is more normal blood flow around the nerves. This is how you get the increased blood flow and increased production of moisture in patients who have very dry vaginas. Radiofrequency can help episiotomy scars and help soften and heal these tissues. It can also be used to shrink up external skin tags and hemorrhoids. But to get rid of hemorrhoids, you usually have to use higher temperatures and ablate them, or in other words, you need to vaporize them away. When treating internally with ThermiVa, you sometimes have a white discharge, and it's sometimes from the goop that you use to lubricate the vagina when you're doing the treatments. It is just some extra lubricant that comes out. In the long term, there is no discharge that's produced by ThermiVa from the result of the treatment itself. It is a natural discharge from the increased blood flow to improve the moisture in the vagina. It's not an infection. It's not a yeast infection. It's not a Gardnerella infection, and it's just a normal discharge that's quite healthy. ThermiVa can be combined with many other procedures. For example, I use ThermiVa when I do labiaplasty surgery if I want to improve the way the external labia majora look. I also use ThermiVa when I do a vaginoplasty repair and I fix the posterior or bottom compartment where the rectum is, but the patient, for example, has leaky bladder or has a dry vagina. I use ThermiVa to improve those situations. So yes, ThermiVa can be used with many other surgeries of the genital tract. ThermiVa can be done 100% of the time without any anesthetics at all. There's no numbing cream needed. There's no general anesthesia. You can treat the entire outside of the vulva and inside of the vagina without any anesthesia at all. You can't do that with lasers. With the outside treatment of lasers on the labia, you need to numb it up. It hurts, especially right at the opening. It hurts a lot when you use lasers in these areas without anesthetic. So the advantage of ThermiVa is that it does not need any anesthesia at all. ThermiVa takes about 10 minutes to perform on the outside and about 10 minutes on the inside. Sometimes as long as 15 minutes on the inside if you're treating a prolapse such as a bladder coming down or a rectum coming down or some incontinence. But typically an internal treatment is about 10 minutes and an external treatment is about 10 minutes. The protocol for ThermiVa is one treatment, about 20 minutes, every month for 3 straight months. After that, we recommend that you have a touch-up treatment every 6 to 12 months, depending on your need and depending if you need it sooner than later. There are really no contraindications to longer treatments for ThermiVa. If the doctor really wants to get the best results, they can treat the outside instead of 10 minutes. If they want to treat for 15 minutes, they can do that. The doctor can get an extra 2 to 3% better tightening results with a little extra time. Internally also, it depends on the patient's comfort if they can put up with it. If the doctor wants to spend more time heating up the inside of the vagina, they can get an extra 2 to 3% tightening effect. My maximum treatment times for those with really saggy external vulva is about 15 minutes. I rarely go more than 10 minutes, but if I have to and I think she needs a little more heat, I'll treat for 15 minutes. Inside the vagina, I treat at 10 minutes at the most, and in special cases, I add an extra 5 minutes. Rarely do I go more than 15 minutes treating the inside of the vagina. After ThermiVa has been completed for 3 treatments about a month apart, I recommend that you have maintenance anywhere from 6 to 12 months apart. It all depends on your tissues and if you're feeling drier or looser. Some patients won't have any touch-ups for a year and a half. I have patients who've seen me for orgasmic dysfunction who we treated the vulva and the vagina and the G-spot and clitoral areas, who are out about 2 years now and are still able to achieve normal orgasms. So it's highly individual, but typically it's every 6 to 12 months. The touch-up treatments can be tailored to what the patient needs. For example, a patient who is very concerned about how the outside looks, I would tell them to come in every 6 months to get a touch-up and tighten up the external skin, because the external skin stays tight only about 4 to 6 months long. And so I tell them to come in sooner. Now, for patients who have dryness in the vagina or have leaky bladder or orgasmic dysfunction, the internal treatments, these patients can come in every 6 to 12 months also. The average patient will come in once a year. For pelvic prolapse, such as a fallen bladder or a fallen rectum, ThermiVa can help when it's mild to moderate. That means the bulge doesn't come further than the hymen. It's a bulge that you can't see on the outside. Once you can see a bulge going outside the vagina, ThermiVa won't be able to help that very well at all. So those who have a bulge that are not coming out of the vagina and is still inside what's called the hymen, you can reduce a mild to moderate prolapse to reduce the symptoms and avoid surgery. It's a wonderful thing to use this device and avoid surgery. Post-procedure, there are no restrictions with ThermiVa. You can go to the gym, you can use the hot tub, you can even have sex. There is zero downtime with ThermiVa. Typically, ThermiVa is recommended to be done every 4 to 6 weeks apart, but there are some centers that are doing ThermiVa as soon as 3 weeks after the first treatment, and so it's acceptable to have a treatment every 3 to 6 weeks. In some situations, you may want to have the treatment sooner, and sometimes that can be acceptable, although 2 weeks is about the time when the moisture comes in, when the fibroblasts start producing more collagen, and things start picking up. So treating at 2 weeks may be a little bit too early, but probably will help. Post-procedure, there is absolutely no downtime. You can go to the gym, you can swim, you can go to the jacuzzi, you can have sex that night. Nothing of your daily life is affected. You can do whatever you want. After ThermiVa procedure, you should expect that at 2 weeks, you're going to start producing more moisture. You will start feeling tighter. You may not have these symptoms relieved until about 2 weeks. There are many that feel tight immediately after their first treatment, and most people with incontinence feel that they're leaking less immediately after the treatment, but it improves over the next 3 months. With ThermiVa, women can resume sexual activities immediately after treatment. You can have sex that night. Now, with laser treatments, since you're putting hundreds of holes in the vagina and there is a discharge and also potential for infection, most laser companies will tell their patients to avoid intercourse for 5 to 7 days before having sex. Not so with ThermiVa. You can have sex that night.